How many of you would believe me if I told you that you could greatly improve the life of an intravenous drug user by giving them needles? Not many of you, right? What if I told you that you could improve the overall health of your community, city, or even country by these same means? What I'm suggesting here is something called needle exchange programs. Most people who haven't heard about needle exchange programs think that I sound crazy right now. But those who work in the public health field know how powerful of a tool they are in the elimination of the spread of HIV and other intravenous transmitted diseases. Considering that we all attend IU, East, Bloomington, or otherwise, we are all Indiana residents that are aware that this is a big problem in our state. According to the Chicago Tribune of March 25, 2015, Southern Indiana experienced the worst HIV breakout in the state's history. Connected to that, the same area has high issues of drug abuse and other infrastructural issues. These issues need to be taken care of as soon as possible, or the issue will continue to spread, starting with Indiana. By closing our minds to the approach of implementing needle and syringe exchange programs, we are ignoring one of the best tools available to us to help prevent the spread of HIV, hepatitis B, hepatitis C, and other problems associated with the use of infected needles. In order to ensure the overall well-being of our communities and all the members in it, it is imperative that we expose the problems, causes, and solutions of a health system that is negating the use of an incredible tool that can benefit the lives of everybody. According to a 2014 stats report from the CDC, injection drug use is the second leading cause of HIV transmission, behind male-to-male sexual contact. Along with direct HIV infection, injection drug use with unsanitary needles leads to other problems as well. The first main problem is obviously the HIV infections. This problem is associated with the fact that intravenous drug users aren't very concerned about their cleanliness and use dirty, potentially contaminated needles to get high. The main infection is obviously HIV. In a Reuters publication from March 2, 2012, it was stated that despite the fact that we've seen declines in new HIV infections, a substantial number of injection drug users in major U.S. cities are HIV infected, and the risk behavior remains fairly high. This entails that the HIV problem being caused from other sources that aren't injection drugs are being managed. So why is this cause not being given as much attention? Especially considering the cost of living with HIV, which in a 2009 CDC stats report was reported that living with HIV costs around $370,000 in a lifetime. The second issue associated with drug users' needle sharing is the transmission of hepatitis C. According to a 2009 study conducted by Burnett Institute, 90% of new hepatitis C infections are attributed to drug use globally. This percentage is 54 in the United States. Hepatitis C is a serious liver disease brought on by a virus that can lead to liver damage, failure, and cancer. Given that the main cause of this condition is injection drug use, why isn't more being done to stop it from happening? Along with HIV, this condition can be spread from mother to child and through sexual contact. Now that we know all these health issues associated with the use of dirty needles, why is our government so reluctant to implement more needle exchange programs? The most common reasons tend to be a conservative mindset and a lack of funding. The first main cause of the problem is that people are against needle exchange programs because it is believed to encourage bad behavior. By giving injection drug users needles, we are seen as enablers. However, what is not realized is that these people will be using drugs whether it's with a clean needle or not. The second issue that comes up is that this creates an apparent acceptance of injection drug use, which community members fear will encourage children and other people in their community to start using drugs because it's more safe. The other main cause of the problem is that the health field specified towards drug abuse is underfunded. The funding that there is allocated towards treatment and rehabilitation centers instead of prevention services. According to the New York Times of May 28, 2009, government spending for drug abuse-related problems reached $468 billion in 2005, which are going towards treatments of long-term issues such as HIV, hepatitis C, and other complications which can be prevented. In order to battle this problem, action must be taken, such as through the nationwide implementation of needle exchange programs. These programs allow intravenous drug users to take in their used, potentially contaminated needles and receive new sterile ones. By eliminating the main transporter of this disease, we hope to reduce the spread of bloodborne pathogens. As presented, the benefits of needle exchange programs outweigh perceived downsides. While it is not ideal in solving the problem of drug addiction, it gives intravenous drug users an opportunity to start taking better care of themselves, even if they aren't ready to completely quit yet. Having a law that requires there to be appropriate needle exchange programs in every county of the United States is a step in the right direction towards not only preventing the spread of serious conditions such as HIV, hepatitis C, and other bloodborne diseases, but will also give addicts a step in the right direction so that they will eventually be motivated to pursue a healthier, drug-free life. There is outstanding work being done every day by public health professionals for those addicted to intravenous drugs. Now we just need more governmental support in order to be able to implement the powerful tools that we have. In summary, while it may seem counterintuitive to give drug addicts the supplies they need to be drug addicts, when looking at the overall problems, causes, and solutions regarding the issue, this apparently absurd approach may lead to success. We all have resources available to us to protect ourselves and our families from dangerous diseases. So why can't we extend that same right to drug users who are just trying to protect themselves?